Hello and welcome to Chapter 11, Long-Term Care Reimbursement. Let's take a look at the learning objectives, and as usual I ask that you review them now and again after reading the chapter. The long-term care system in the United States is reimbursement driven, meaning that the way care is provided is highly dependent on the way it is financed. Services are not universally and uniformly available. Each of the provider segments along the continuum of care has its own unique mix of payment sources. So when we look at the origins and developments, this began as charity-based care for all except the very wealthy. State and federal government began to get involved in protecting the welfare of the poor and needy. We want to take a look at the Social Security Act of 1935, which had a big impact, Medicare and Medicaid in 1965, which followed with another huge impact. Current reimbursement options can be broken into three categories for easier study. They are public sources, private sources, and public-private partnerships. Public reimbursement sources, let's take a look at those. Medicare and Medicaid are by far the most prominent sources of public funding of long-term care and other types of health care. Medicare, Title 18 of the Social Security Act, its primary purpose was to provide health care coverage for the elderly. It has four parts, so let's take a look at these. Part A provides hospital insurance, including some sections of long-term care, such as skilled care, home health care, hospice. Part B provides supplementary medical insurance that covers physician care. Part C deals with managed care organizations. And Part D covers medications. So Medicare, what's covered? Skilled nursing services and nursing facilities or units in hospitals is where that takes place. Subacute care, covered under the category of post-acute care. It is generally provided in Medicare certified SNFs or units and is reimbursed through the SNF mechanism. When I say SNF, I mean skilled nursing facility. Home health care is the primary provider of reimbursement for home health care services. Hospice for people who are certified to be terminally ill with 6 months or less to live. The care must be palliative rather than curative, and as with other types of Medicare coverage, it must be delivered by a provider organization that is certified by that program. Other coverage may be included in settings such as assisted living or adult daycare under some Medicaid waiver programs. Okay, Medicaid is Title 19 of the Social Security Act. It covers only those who are medically indigent and who cannot pay for their own health care or have insurance. It has no age limitations. It is jointly funded by the federal and state government and is run by the states under federal guidelines. So Medicaid, what's covered? Nursing care facilities covers just about all services for them. Assisted living, called residential care facilities in some states, coverage is far from universal, varying from state to state, but it is growing. Much of the Medicaid coverage of assisted living has resulted from waiver programs. And so I encourage you to take a look at the supportive living program that Illinois has, which is funded by Medicaid. Home health care. Medicaid is the largest source of funding for home health care agencies and is often used to supplement Medicare coverage for low-income seniors. Other forms of long-term care, such as subacute care, hospice, and adult daycare, are generally not covered by Medicaid, but may be covered as a supplement to Medicare or under some of the waiver innovations. We have Medicaid waiver programs that the area agencies on aging use in Illinois to provide homemaker services. State efforts to reduce Medicaid expenses. Medicaid is one of the top 2 or 3 most expensive items in many states' budgets. It's increased efforts to reduce, there are increased efforts to reduce Medicare cost. By reducing the amount of care received by Medicaid recipients and facilities, by raising the eligibility requirements for institutional care, and through increased use of managed care. Medicaid spend down requirements are consumers must use up all other resources before they can become eligible for Medicaid, and then payment bundling as well. Other public funding sources includes the Supplemental Security Income Program, SSI, the Veterans Administration, and the Older Americans Act. They serve limited populations. Private reimbursement sources account for about 1/3 of all long-term care coverage. Out-of-pocket payments are less than 1/4 of the total cost. Private long-term care insurance is a small but growing portion of long-term care financing. Little is covered under employer-sponsored policies. Okay, public and private partnerships, programs that seek ways to provide incentives for individuals to purchase long-term care insurance. The primary incentive is asset protection in return for meeting some of the cost of long-term care. In 2006, Congress approved legislation clearing the way for expanded nationwide public-private long-term care LTC insurance partnerships. Managed care is a system of health care delivery that tries to manage the cost of health care, the quality of that health care, and access to that care. Managed care, how it works. Well, organizations that delivered health care to a specified group of members on a fixed rate basis, regardless of how much service they required. Managed care and long-term care, to look at that. For long-term care, it has taken hold much more in some parts of the country than in others. It has grown in public payments, particularly Medicaid, and the types of managed care are provider arrangements, which per diem, discount from charges, case rates, and capitation. Medicaid and Medicare managed care. Medicaid in the past 15 years, states have increasingly relied on managed care for Medicaid benefits. Medicare managed care is found in the form of Medicare Advantage plans. Managed care making the transition, when we look at that, long-term care providers must look carefully before partnering with a managed care organization, but it usually makes sense. Managed care, a tarnished image. The tarnished image has suffered from a perception that MCOs put cost control ahead of quality of care or the interest of the consumers. So the significant trends and their impact, let's take a look at these. Private managed care is becoming increasingly attractive. Public managed care, is growing as a way to save cost, and prospective payment has replaced retrospective reimbursement for most of the long-term care. Emphasis on community-based care is the result of both cost cutting and increased demand for consumer choice. Incentives for purchase of private long-term care insurance. There are few incentives today, but more needed if it is to be an important reimbursement source. Liability cost and tort reform. Now, these are expensive lawsuits have driven up insurance costs, but there has been little in the way of reforming the tort system. Financing reform. There has also been much talk about reforming the overall U.S. healthcare system, which really means reforming the healthcare financing system. The debate, which culminated in the Affordable Care Act of 2010, the ACA, centers on providing coverage for people needing acute and preventative care. So here I ask that you review the summary and now read the chapter and once again review the learning objectives to be sure that you have met them. And I thank you.